Have you ever opened your eyes in the morning and noticed the world around you seems out of focus? You're not alone. Millions of adults over 60 experience blurry vision shortly after waking up. While most dismiss it as just part of getting older, the truth is far more complex and potentially more dangerous. In this video, we'll dive into the real reasons behind morning blurry vision. You'll learn why your blood sugar levels may be interfering with your eyesight before you even eat breakfast, how allergens hiding in your bedroom could be silently irritating your eyes while you sleep, the surprising role of sleep posture on your eye pressure, and how it might relate to glaucoma, the hidden link between dry eyes and blurry vision, which nutrients can actually reverse some of this visual fuzziness, and simple, science-backed tips to regain clear, sharp vision every morning. This isn't about scaring you, it's about equipping you. Because your vision is not just a reflection of your eyes. It's a reflection of your brain, your circulation, your sleep, your metabolism, your overall health. Whether you've been waking up to cloudy eyesight for weeks, or just now started to notice it, this video could give you answers you've never heard before. We'll back every insight with solid science, referencing studies from institutions like the Mayo Clinic, the American Academy of Ophthalmology, and Harvard Medical School. If you'd like to support the creation of more helpful, science-based health videos like this one, please consider subscribing to the channel. It helps us grow, reach more people, and continue to bring you practical tools to live a longer, healthier life. Section 1. Blood sugar spikes at night, the hidden link to morning vision problems. You might not associate your eyesight with what's happening in your blood overnight, but the truth is, they're deeply connected. Let's start with a simple fact. Your eyes are incredibly sensitive to changes in glucose levels. They're one of the most metabolically active parts of your body. That means even small fluctuations in blood sugar, especially during the night, can impact how well your eyes function by morning. So what happens while you're asleep? If you eat a carbohydrate-heavy dinner, indulge in a late-night dessert, or even skip a balanced meal altogether, your blood glucose may spike and crash unpredictably. During the night, this can lead to what's known as nocturnal hyperglycemia, an elevation in blood sugar that you don't feel, but your body certainly does. And your eyes? They're quietly absorbing the consequences. Elevated glucose levels overnight can cause fluid to shift into the lens of the eye, altering its shape and temporarily distorting your ability to focus. That's why you might wake up with hazy, foggy, or unfocused vision that gradually improves throughout the morning. This is not random. It's your eye's physical response to sugar-driven swelling and fluid imbalance. A 2022 study published in Diabetes and Vision Research highlighted that even short-term fluctuations in nighttime blood glucose were directly correlated with next morning visual acuity in older adults. Participants who experienced greater variability in their nighttime glucose levels reported significantly more blurred vision upon waking. The effect was strongest in individuals over the age of 65. But that's just one side of the story. There's also oxidative stress. High glucose triggers inflammation and oxidative stress in the retina, especially in individuals already experiencing mild diabetic or prediabetic changes. Over time, this can lead to damage in the microvasculature of the eye, setting the stage for diabetic retinopathy, even in people who aren't officially diabetic. So even if you've never been diagnosed with diabetes, your morning vision might still be silently warning you about your blood sugar regulation. How do you know if this is affecting you? Pay close attention to patterns. Do you often experience blurry vision within 30 minutes of waking up? Does it seem to resolve after breakfast or mid-morning? Do you feel groggy, dehydrated, or notice your fingers feel stiff or swollen? These may all be subtle indicators that your overnight glucose control isn't optimal. What can you do? Here are some practical, evidence-based tips. Avoid high-sugar snacks before bedtime. Skip the cookies, cakes, or sweetened drinks at night. These can trigger a glucose spike while you sleep. Choose balanced dinners. Combine lean proteins, healthy fats, and complex carbohydrates, like salmon with steamed vegetables and a small portion of quinoa. Have a small protein-rich snack if needed. A handful of nuts or half a boiled egg before bed may help stabilize overnight blood sugar. Track your glucose trends. If you have access to a glucose monitor, or even just track your food and morning symptoms, you may begin to see correlations that guide your choices. Stay hydrated. Dehydration compounds visual distortion by increasing eye pressure and altering tear film stability. Most importantly, if this symptom persists, consult a healthcare provider to check your fasting glucose and A1C levels. Your eyes might be telling you a story your lab results haven't revealed yet. Vision isn't just a sense, it's a signal. And sometimes, the blur you wake up to is your body's way of saying, pay attention. Section 2. Hidden bedroom allergens and morning eye blur. What if the reason you wake up with itchy, blurry, or puffy eyes isn't aging, but your bedroom? Yes, your own bed may be silently undermining your eye health. And no, we're not talking about poor sleep hygiene or screen time this time. We're talking about allergens, specifically the microscopic, invisible enemies you sleep with every night. Dust mites, pet dander, mold spores, and airborne irritants embedded deep in your pillows, blankets, and mattresses. Let's start with the science. Dust mites are tiny arachnids that feed on the dead skin cells we shed every night. They thrive in warm, humid environments, just like your mattress. In fact, one study published in Clinical and Experimental Allergy found that a single mattress can house up to 10 million dust mites, especially in homes with older bedding and carpeting. But what do they have to do with your eyes? Everything. These allergens trigger low-grade, chronic inflammation in the conjunctiva, the thin, transparent membrane that covers the white part of your eye. Overnight exposure can lead to conjunctival congestion, puffiness, and blurred vision first thing in the morning. Even if you don't experience full-blown allergic reactions like sneezing or rashes, your eyes may still be reacting quietly. Symptoms may include morning eye itchiness, redness without cause, eyelid puffiness, mild visual distortion or film over vision, a gritty or dry sensation upon waking. Over time, these repeated microirritations can destabilize the tear film and worsen existing conditions like dry eye syndrome, which is already common in individuals over 60 due to hormonal and metabolic changes. A study published in the Journal of Ophthalmic Inflammation emphasized the cumulative effect of environmental allergens on ocular surface integrity. Even minor exposures, especially during sleep when blinking and tear production are reduced, can cause measurable changes to visual clarity upon waking. Now consider this. Every hour you sleep, you're in close contact with these irritants. So what can be done? Here are actionable strategies to reduce allergen exposure and protect your eyes. Wash your bedding weekly in hot water, at least 130 degrees Fahrenheit, 54 degrees Celsius. This effectively kills dust mites and removes pollen and skin cells. Use allergen-proof mattress and pillow covers. These create a physical barrier between you and the mites. Avoid feather pillows and comforters. Opt for hypoallergenic, synthetic alternatives. Replace your pillows every 1 to 2 years and vacuum your mattress regularly using a HEPA filter vacuum. Control bedroom humidity. Dust mites love moisture. Aim for relative humidity below 50% using a dehumidifier if needed. Keep pets out of the bedroom. Their dander can linger on fabric surfaces for weeks and become airborne every time you move. Install an air purifier with a HEPA filter. This helps trap allergens that would otherwise settle in your bedding and lungs. Also, don't overlook mold. If your bedroom has poor ventilation or hidden dampness near windows or behind furniture, mold spores could be adding to the allergen load. These too can trigger ocular inflammation and contribute to morning visual distortion. If you're waking up frequently with blurry vision, but your eye exams are normal, consider what's in your bedroom air. Sometimes, improving your vision isn't about new glasses. It's about cleaner air, cleaner pillows, and smarter habits. Intraocular pressure, or IOP. And that matters because elevated IOP is one of the strongest risk factors for glaucoma, a leading cause of irreversible blindness worldwide. Let's break this down. While you sleep, the pressure inside your eyes naturally fluctuates. This is normal. However, certain positions, especially sleeping on your side or face down, can dramatically increase pressure in the eye that's pressed against the pillow. Think of it like placing your hand on a water balloon. The pressure inside rises the more it's compressed. A study published in Investigative Ophthalmology and Visual Science found that intraocular pressure increased significantly in participants who slept on their sides, particularly if their heads were turned downward into the pillow. For those with existing optic nerve damage or borderline glaucoma, this seemingly innocent habit could accelerate disease progression without any warning signs. Why is this so dangerous? Because glaucoma is often called the silent thief of sight. It causes gradual vision loss, starting with peripheral vision, and most people don't even realize something is wrong until major damage has already occurred. Unlike high blood pressure, you won't feel it. There's no pain, just slow, steady loss. So how can your sleeping posture possibly make this worse? Lying on one side for prolonged hours, especially if it's always the same side, can create a consistent pressure imbalance between the two eyes. Over time, this may explain why glaucoma tends to be worse in one eye than the other. Face-down sleeping, particularly common among those with neck or back issues, is even riskier. It can raise eye pressure for the entire duration of the night. Let's say you're asleep for 7 hours. If you spend 6 of those hours compressing one eye, that eye is living under elevated stress, night after night. What can you do about it? Here are science-backed suggestions to reduce sleep-related eye pressure risks. Sleep on your back whenever possible. It's the most neutral position for both your spine and your eyes. Use a soft, supportive pillow, one that reduces facial pressure and allows your head to stay in a gentle, upward-facing position. Avoid sleeping with your head lower than your heart. Elevated pillows or adjustable beds can help maintain optimal blood and fluid circulation. Change sides regularly. If you must sleep on your side, alternate throughout the week so one eye isn't always under pressure. Talk to your eye doctor. If you've been diagnosed with glaucoma or are at high risk, mention your sleeping habits. There are even special sleep masks and pillow designs for glaucoma patients. And here's something many don't realize. Elevated eye pressure during the night can go completely undetected by standard eye exams. That's because most exams are performed during the day, when your IOP might be perfectly normal. Some ophthalmologists now recommend 24-hour pressure monitoring for patients at high risk, using contact lens sensors or home tonometry devices. Also worth noting, certain lifestyle factors can interact with sleep posture to raise risks even more. For example, sleeping after consuming alcohol, sedatives, or salt-heavy meals can increase nighttime fluid retention, contributing to even higher IOP. So the bottom line is this. If you're over 60, your sleep is no longer just about rest. It's also a time when your eyes may be under pressure, quite literally. Protecting your vision doesn't start with eye drops or surgery. It starts with awareness, and perhaps a small adjustment to how you lay your head at night. Section 4. Dry eyes and morning blurriness. Why aging eyes wake up cloudy. As we age, our eyes naturally produce fewer tears. But here's the catch. Tears aren't just for crying. They form a thin, protective film over your eyes that allows light to focus properly and keeps the surface of your eye smooth, hydrated, and healthy. When that film is too thin or evaporates too quickly, the result is what experts call visual noise, blurry, shifting, or fluctuating clarity. But why does this happen especially in the morning? During sleep, your blink reflex, nature's way of spreading tears across the eye, is essentially offline. Your eyes are closed, tear production is reduced, and in many older adults, the meibomian glands, which produce the oily layer of your tears, have become clogged or less active. This leads to faster evaporation of tears, especially in dry indoor environments. The result? You wake up with eyes that feel sandy, sticky, and unable to focus clearly for the first minutes, or even hours, of your day. According to a 2023 study published in the Ocular Surface Journal, over 65% of people above 60 report moderate to severe dry eye symptoms upon waking. And in nearly half of them, this symptom goes undiagnosed because they assume it's just part of getting older. But chronic dry eyes are not a harmless annoyance. Over time, the lack of proper lubrication can cause microabrasions on the corneal surface, trigger chronic inflammation, and even make the eyes more vulnerable to infections. And for those already dealing with cataracts, glaucoma, or macular degeneration, dry eyes can worsen visual quality and delay recovery from eye procedures. So what can you do to wake up with clearer vision and healthier eyes? Here are evidence-based strategies to tackle dry eyes, especially overnight. Use a humidifier in your bedroom. Dry indoor air, especially during winter or in air-conditioned rooms, can exacerbate overnight evaporation. Apply preservative-free lubricating eye drops before bed. These act as a protective barrier throughout the night. Warm compresses in the evening. This helps unclog oil glands and stabilize the tear film. Eyelid hygiene. Clean your eyelid margins with a gentle cleanser to remove bacteria and debris that may block oil glands. Omega-3 fatty acids. Clinical trials have shown that omega-3 supplements, particularly from fish oil or flaxseed oil, can improve tear stability. Stay hydrated. Dehydration affects every cell, including the cells that produce your tears. Also worth noting, some medications commonly taken by older adults, like antihistamines, antidepressants, and certain blood pressure pills, can reduce tear production as a side effect. If you suspect this may be contributing to your symptoms, talk to your doctor about alternatives or supportive eye care strategies. Another overlooked cause? Incomplete eyelid closure during sleep. This condition, called nocturnal logophthalmos, is more common than you think and leads to tears evaporating even with closed lids. A sleep mask or ophthalmic gel may help in such cases. Here's a quick tip. If your vision is always blurry in the morning but improves after blinking or using drops, that's a strong indicator that dry eyes are to blame, not necessarily a deeper neurological or optical issue. So next time you wake up and your world looks like a smudged painting, don't just wipe your glasses or rub your eyes. Understand that your eyes may be silently asking for help. The good news is, with a few simple adjustments, you can dramatically improve your morning clarity and protect your long-term visual health. Section 5, Omega-3 and Eye Health, the science behind the clarity. Let's talk about something that sounds simple, but may be one of the most powerful protectors of your aging vision: omega-3 fatty acids. You may already know omega-3s for heart health or brain function, but when it comes to your eyes, especially after 60, the evidence is undeniable. Omega-3s are not just helpful, they're essential. So, what exactly are omega-3s? They're a group of polyunsaturated fatty acids, and the two most important types for eye health are EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. DHA, in particular, is found in extremely high concentrations in the retina, the light-sensitive tissue at the back of your eye responsible for sharp, detailed vision. In fact, your retina is one of the most metabolically active tissues in your body. It needs constant nourishment and protection from oxidative stress, inflammation, and cellular damage. That's where omega-3s step in. According to a large clinical trial published in the Journal of Investigative Ophthalmology and Visual Science, individuals over 60 who consumed high levels of DHA and EPA had significantly lower risks of developing age-related macular degeneration, AMD, one of the leading causes of vision loss in seniors. But the benefits of omega-3s don't stop there. They also play a vital role in reducing dry eye symptoms. How? By improving the quality of the tear film, especially the oily layer that prevents your tears from evaporating too quickly. This is why many ophthalmologists now recommend omega-3 supplements or fatty fish consumption as part of dry eye treatment protocols. A 2021 study from the American Journal of Clinical Nutrition showed that participants who took daily omega-3 supplements for 12 weeks had a 42% improvement in tear stability and reported significantly less eye discomfort. Still wondering if this applies to you? If you often feel your eyes are gritty, dry, or tired, even when you've had enough rest, low omega-3 intake may be a factor. And if you've already been diagnosed with early signs of AMD or suffer from blurry vision that fluctuates throughout the day, omega-3s may be one of the simplest yet most overlooked defenses in your daily routine. Here's how to get them. Fatty fish, salmon, sardines, mackerel, and anchovies are excellent sources. Aim for at least 2 servings per week. High-quality supplements. Choose those with at least 500 milligrams of DHA and EPA per capsule, and make sure they're third-party tested for purity. Plant-based alternatives, flaxseed, chia seeds, and walnuts contain ALA, alpha-linolenic acid, a precursor to EPA and DHA, but the conversion rate in the body is very low. Still, they're helpful additions. Cook smart, avoid omega-6 heavy oils like soybean and corn oil, which can compete with omega-3s and increase inflammation. A quick note, if you're on blood thinners or have certain medical conditions, always consult your doctor before starting omega-3 supplements. They're powerful and deserve the same respect as medication. Here's something else to consider. Omega-3s don't just work in isolation. They perform best in combination with antioxidants like vitamin C, vitamin E, and zinc. This synergy is the foundation of the ARDS2 formula, a gold standard supplement blend recommended for patients at risk of macular degeneration. So yes, omega-3s might seem like a small thing, but when it comes to preserving your ability to read, drive, recognize faces, or simply enjoy the beauty of a sunset, they're nothing short of a vision-saving miracle. Section 6, Eye-Friendly Breakfast. Recipes that nourish your vision. What if the first meal of your day could help protect your eyes from aging? What if your breakfast didn't just fill your stomach, but also boosted your retinal health, reduced inflammation, and supported sharper, clearer vision for the years ahead? Today, we'll explore just that. You've heard the phrase, "You are what you eat." But when it comes to eye health, You see, what you eat might be even more accurate, especially for those over 60. The foods you consume in the morning can either fuel or fatigue your eyes. Let's break down 3 easy, delicious, and science-backed breakfast options designed specifically to support your eye health. Breakfast 1. Spinach and egg omelette with avocado toast. This power-packed combo is rich in lutein and zeaxanthin, 2 carotenoids that accumulate in the retina and act as natural blue light filters. Spinach is loaded with them, while eggs provide bioavailable forms of vitamin A and choline, crucial for nerve transmission. Avocado adds healthy monounsaturated fats, which help your body absorb these carotenoids more efficiently. The whole grain toast adds fiber and steady energy. Bonus tip: add a drizzle of extra virgin olive oil to your omelette to enhance absorption even further. Breakfast 2. Turkish Greek yogurt with berries, walnuts, and chia seeds. Turkish Greek yogurt gives you high-quality protein and probiotics, both of which are linked to lower systemic inflammation, a known contributor to retinal degeneration. Berries, especially blueberries and blackberries, are packed with anthocyanins and vitamin C, both proven to support the microcirculation in your eyes. Walnuts and chia seeds deliver plant-based omega-3s, and chia also adds soluble fiber for glucose balance, important for preventing diabetic eye damage. Bonus tip: add a small drizzle of honey for sweetness without causing a glucose spike, and avoid sugary granola. Breakfast 3. Golden oatmeal with turmeric, flaxseed, and almond butter. Oats offer complex carbohydrates that release energy slowly, helping prevent blood sugar spikes that strain the tiny vessels in your eyes. Turmeric contains curcumin, a powerful anti-inflammatory compound shown in studies to reduce oxidative stress in the retina. Flax seeds add more omega-3s and lignans, plant compounds with antioxidant effects. Almond butter adds vitamin E, essential for protecting eye tissues from age-related oxidative damage. Bonus tip: steep the oats in unsweetened almond milk overnight for a soft, no-cook version that saves time and boosts flavor. Now, you might be wondering, why breakfast? Here's why. After fasting overnight, your body is in a nutrient absorption mode. Whatever you feed it in the morning gets prioritized for cellular repair, energy production, and inflammation response. If you fill your system with refined carbs and sugars, you promote insulin spikes and oxidative stress. But if you start the day with antioxidant-rich, omega-3 packed, nutrient-dense meals, you lay the foundation for sharper vision and healthier eyes. Scientific research published in the Journal of Nutrition and Aging found that older adults who consumed high antioxidant breakfasts over 6 months showed measurable improvements in retinal sensitivity and contrast detection, 2 markers of functional vision. So this isn't about trends or fads. It's about real science applied at the breakfast table. Quick recap: include greens like spinach or kale whenever possible. Choose omega-3 rich seeds and nuts. Avoid added sugars and fruit juices. Go for whole fruits instead. Add colorful ingredients: yellow yolks, dark berries, orange turmeric. All of them are rich in vision-protecting compounds. And finally, drink water. Dehydration affects the tear film and can worsen dry eyes first thing in the morning. Section 7. Morning eye exercises for sharper vision. Did you know that just like your body, your eyes have muscles too, and they need exercise to stay strong? Especially as we age, those tiny muscles responsible for eye movement and focus begin to lose their flexibility. This contributes to blurry vision, difficulty shifting focus, eye fatigue, and even balance issues. But here's the good news. Just 5 minutes of focused eye movement each morning can help maintain your visual sharpness, reduce morning blurriness, and support long-term eye health. Today, we're diving into 5 simple yet powerful morning eye exercises you can do right from your bed or breakfast chair. No equipment, no apps, just you and your eyes. 1. The focus shift drill. Train your flexibility. Hold one finger a few inches from your nose and fix your gaze on it. Then, shift your focus to something 10 feet away, like a wall or window frame. Hold each focus point for 5 seconds and repeat 10 times. This trains the ciliary muscles, which control the shape of your eye lens and your ability to focus at different distances. Over time, it can ease the near-to-far lag many older adults experience when driving or reading. 2. The 8 movement eye roll, full range of motion. Imagine a large number 8 laid on its side, an infinity symbol. Slowly trace that figure with your eyes without moving your head. Go clockwise for 30 seconds, then reverse. This exercise boosts oculomotor control, improving the coordination between your brain and eye muscles. It can help reduce the jerky vision effect you may feel when changing gaze quickly. 3. Palming, calm the eye nerves. Rub your hands together until warm, close your eyes, and gently cup your palms over them, without pressing. Take 10 slow breaths while resting your eyes in darkness. This simple technique relaxes the optic nerve and reduces sympathetic nervous activity. It's especially helpful if you wake up feeling stressed or have tension-related blurry vision in the morning. 4. Blinking reboot, hydrate and refresh. Yes, blinking is an exercise. And after sleep, many people don't blink enough, leading to dry, scratchy vision. Set a timer and consciously blink every 4 seconds for 2 minutes. This stimulates tear production, resets your tear film, and prevents light scattering from dry spots on your cornea. Bonus tip: follow this with a sip of water to rehydrate from the inside too. 5. The near-far challenge, improve eye strength. Stand by a window. Hold a small object like a pen in front of your nose and shift your focus between the pen and a distant tree or rooftop. Move your head slightly from side to side while keeping your eyes on target. This dynamic training supports depth perception, balance, and eye stability, all crucial for preventing falls and spatial confusion, especially in older adults. Why morning is the best time? After a night of closed eye stillness, your visual system needs time to fully wake up. These exercises activate the extraocular muscles, stimulate the retinal pathways, and prepare your eyes for the light, focus, and movement they'll face during the day. Think of it like stretching before a walk. You wouldn't just jump out of bed and sprint. So why do we expect our eyes to instantly adapt to bright light, reading, and screens without warming up? In fact, studies published in Aging Clinical and Experimental Research have shown that regular ocular muscle activity improves contrast sensitivity and reaction time in older adults, 2 key measures of visual performance. Quick recap. Do 5 minutes of eye movement before reading or screen use. Breathe deeply while doing them. Oxygen matters. Consistency is more important than intensity. Daily small efforts yield lasting results. Combine these exercises with a healthy diet, hydration, and proper lighting to maximize benefits. Remember, clear vision isn't just about having the right glasses. It's about supporting the entire visual system: muscles, nerves, retina, and brain. Section 8. Proven supplements that sharpen your vision. Not all supplements are worth your time or money. But when it comes to your eyes, certain nutrients have passed the test of science. Especially after age 60, your visual system becomes more vulnerable to oxidative damage, inflammation, and circulation issues. That's where targeted supplementation can make a real difference. Today, we'll explore 3 of the most researched and trusted compounds for eye health: Lutein, Zeaxanthin, and Astaxanthin. These are not miracle pills, but when taken consistently, they can support your retina, reduce strain, and help you maintain clearer vision into your later years. Let's take a closer look at what they are, how they work, and how to use them wisely. Lutein, the retinal bodyguard. Lutein is a yellow-orange pigment found in leafy greens like spinach and kale. But unless you're eating large bowls of them daily, you're probably not getting enough. This nutrient concentrates in the macula, the central part of the retina responsible for detailed vision. Think of lutein as sunglasses for your eyes. It filters harmful blue light, absorbs excess energy from sunlight and screens, and protects against age-related macular degeneration, AMD. A large clinical trial known as ARDS-2, Age-Related Eye Disease Study 2, conducted by the National Eye Institute, found that daily supplementation of lutein significantly reduced the risk of AMD progression in older adults. Typical dose: 10 milligrams per day, preferably taken with a meal containing fat for better absorption. Zeaxanthin, lutein's vision partner. Often paired with lutein, zeaxanthin is another carotenoid that works in harmony to protect the eye's most sensitive tissues. While lutein is found throughout the retina, zeaxanthin is especially concentrated in the macular center, where the highest visual acuity is processed. Its antioxidant power helps neutralize free radicals that cause retinal damage and blur. Studies show that people with higher blood levels of zeaxanthin have better contrast sensitivity, meaning they can see sharper edges and clearer differences between light and dark, especially important for safe driving and reading in dim light. Typical dose: 2 milligrams per day, often included in high-quality eye supplements alongside lutein. Astaxanthin, the anti-inflammatory super antioxidant. If lutein and zeaxanthin are your eye's protectors, astaxanthin is its firefighter. Extracted from microalgae, This deep red pigment has one of the highest antioxidant capacities of any known compound. What makes it different? Astaxanthin crosses the blood-retinal barrier, reaching both the front and back of the eye. It reduces ocular inflammation, improves blood flow to the retina, and enhances endurance of the ciliary muscles, which control focus. Several clinical studies, including one from Journal of Clinical Therapeutics, have shown astaxanthin helps reduce eye fatigue, supports recovery after screen exposure, and even improves subjective clarity in patients with early macular degeneration. Typical dose: 4 to 12 milligrams per day, depending on health goals and under medical supervision. How to supplement safely and effectively. Take with food. These are fat-soluble nutrients, so absorption is improved when taken with meals containing healthy fats, e.g. olive oil, avocado, nuts. Check for combinations. Many vision-focused supplements combine all three in clinically studied ratios. Watch for oversupplementation. More isn't always better. Follow label instructions or speak with your doctor, especially if you're on medications or have liver or kidney conditions. Choose quality brands. Look for third-party tested products to avoid fillers or contaminants. Do they replace a healthy diet? No, but they amplify it. Supplements are just that, a supplement to your daily habits. If your breakfast still includes added sugars and your hydration is poor, no capsule will fix your vision. But when paired with green vegetables, colorful fruits, omega-3 rich foods, plenty of water, and the exercises we discussed earlier, these compounds can offer measurable support for your eyes, especially during the morning hours when oxidative stress is highest. If you've made it this far, thank you. You've just learned the key reasons why your vision might feel blurry each morning, and more importantly, what you can actually do about it. If this video helped you, please subscribe to this channel. That simple act allows us to keep creating helpful, science-based content to support your health as you age. And I'd love to hear from you. Let's talk in the comments below.